Hello, everyone. It's a great privilege and pleasure to have Dr. Terry Wahls with us today. Thank you so much, Dr. Wahls, for joining us. It is really
thank
such
you.
an honor to have you here.
Thank you.
A short introduction for those of you who may not be familiar with Dr. Wahls and her outstanding work is that Dr. Terry Wahls is a clinical professor of medicine at University of Iowa Carver College of Medicine in Iowa City, Iowa State, where she teaches internal medicine residents in their primary care clinics. She also does clinical research and have published over 60 peer-reviewed scientific abstracts and papers. She is the author of the Wahls Protocol, How I Beat Progressive MS Using Paleo Principles and Functional Medicine. The Wahls Protocol, second book, The Wahls Protocol, which is my go-to book every day. A radical new way to treat all chronic autoimmune conditions using paleo principles, as well as her cookbook called The Wahls Protocol, Cooking for Life, the revolutionary modern paleo plan to treat all chronic autoimmune conditions. In year 2000, she was diagnosed with secondary progressive multiple sclerosis, which at one point she was confined to a tilt reclined wheelchair for 4 years. However, she restored her health miraculously using a diet and lifestyle program designed specifically for brain, spinal cord, and nervous system in general. And now she not only walks perfectly, but she jogs and pedals her bike to work every day. So, Dr. Wahls, please tell us about your MS story and healing journey.
Yeah, so during medical school, 1982, I began having electrical zingers in my face that would gradually become more frequent, more severe over the next 20 years. Then in 2000, I developed weakness in my left leg. I see my neurologist and begin the workups. And eventually I'm diagnosed with relapsing-remitting multiple sclerosis. I do my research. I find the best MS center in the country. I take the newest drugs, but 3 years later, at age 48, I'm in the tilt recline wheelchair, and it's very clear that things are going relentlessly downhill. By age 52, despite taking mitoxantrone, a form of chemotherapy, Tysabri, the new biologic agent, I'm in that tilt recline wheelchair. I can no longer sit up. I'm in a zero gravity chair with my knees higher than my nose. Fortunately, I'm still mentally clear, so I'm still staffing the resident clinic. I'm a member of the Institutional Review Board, reviewing research protocols. And I tell the IRB I want to review all the brain-related stuff. I'm getting better at reading science, better at reviewing science as it relates to conditions with shrinking brains and spinal cords. I decide that mitochondria are what's driving disability. I create a supplement cocktail for my mitochondria. My fatigue has helped a little bit. I'm immensely grateful. I discover a study using electrical stimulation of muscles. I ask my physical therapist, and we begin testing electrical stimulation, and we add that to my regimen. I discover the Institute for Functional Medicine. I take their course in neuroprotection. I have a longer list of supplements, and then I had this really big aha. Like, what if I redesign the Paleolithic diet that I've been following already for 5 years based on this long list of supplements I'm taking? So it's a few more months of research figuring out, Melody, where those nutrients are in the food supply. And now in December of 26th, 2007, I start this new way, this highly structured paleo diet. Now at that time, I'm beginning to have brain fog. My trigeminal neuralgia is relentlessly worse. I can take a few steps using 2 walking sticks. Otherwise, I'm in that tilt recline wheelchair. And I'm in a zero gravity chair at work and a zero gravity chair when I'm with my family and taking my meals. I start this new way of eating. I go off to the new clinic I've been assigned, the Traumatic Brain Injury Clinic. And the first 2 weeks, I just watch my partners. The third week, I have to start examining patients. And to my amazement, after that first week, I realized I think I can do this. And as a matter of fact, I even come home and tell Jackie, I'd like to sit at the table in a regular chair. So we get a regular chair out. I take my meal, and it goes okay. And when I see my physical therapist, he says, Terry, you're definitely getting stronger. And he begins advancing my exercises. I do 10 minutes now twice a day, then 15 minutes twice a day, then 20 minutes twice a day, then 30 minutes twice a day. And then I start walking with walking sticks in the hospital, stunning my colleagues.
Wow.
And then I begin walking with one walking stick, on Mother's Day. So really not that long. I'm like 5 months into this. I really want to try riding my bike, which I've not done in 6 years. And so we had this emergency family meeting. My 2 kids who are teenagers, they don't want me to do that because they don't want me to risk falling and, having a major setback. But Jack decides that we can try. We all get in a position. And she tells my 16-year-old boy, 6'5", Zach, you run alongside on the left. Zebby, who's 13, you run alongside on the right, and she'll follow. We all get in a position, and she gives the all clear. I push off, and I bike around the block.
Wow.
And now that big 16-year-old boy, he's crying. The 13-year-old girl, she's crying. Jackie's crying. And of course, when I relive that moment, tears still come to my eyes, because that's when I realized that the current understanding of progressive multiple sclerosis is incomplete. And who knows how much recovery might be possible. After that, I biked a little bit more every single day. And in October, Jackie comes home and telling me that she signed me up for the Courage Ride, which is 18.5 miles.
Wow.
However far we go will be a triumph. And I have to have several little breaks, but I do make it all 18.5 miles. So once again, my kids are crying, Jackie's crying, I'm crying. And this fundamentally transforms how I think about disease and health. It will transform how I practice medicine, and it will transform the research that I do. And I've since made it my mission to teach the public that there is so much that we can do to change the trajectory of our healing journey, regardless of what type of chronic autoimmune or neurodegenerative problem that you've been diagnosed with.
Wow, it's truly inspiring, Dr. Wahls. Every time I hear your story, I get shivers in my whole body. It's amazing. It's easy to hear it, but for someone who's experiencing it, it's profound. Changing from wheelchair to bike riding. This is not.
And it was less than a year. It was less than a year. So whoever is listening, whatever your physicians have told you that you have a progressive illness, that there's nothing more that can be done, there are always things under our control that will impact your healing journey. So please have hope. If I can recover from such profound disability to such a rich and full life that I now enjoy, there's hope for you as well.
Thank you, Dr. Wahls. Thank you so much.